All right. Good afternoon, everyone. Buenas tardes. I would like to welcome you to this summit session titled Our Children and Community, a Conversation on Vaccines and Impacts of COVID-19. My name is Omar Alejandro Ibarra. It's so good to be with you here today. I am the CHCI AHIP Health Graduate Fellow working on public health and healthcare related issues in the office of Senator Ben Ray Lujan. I'm delighted to be with you today for this session. As we all have likely heard and come to understand, the pandemic has disproportionately impacted Latinos and communities of color. Vaccine rollouts has been inequitable, and historical racism and trauma within the health system have made our communities wary of seeking care at times. These factors impact the health of Latino families and children. And of course, as new COVID variants continue to emerge, it is paramount to understand how to best roll out vaccines for children and how to eliminate barriers to care for our community and to protect Latino children. On behalf of CHCI, I would like to thank Health Distribution Alliance and Pfizer for their generous support for this session. I would also like to thank our panel chair, Representative Lori Trahan, proudly serving Massachusetts' 3rd District. She is currently a member of the powerful House Committee on Energy and Commerce, and she is also a fierce advocate for the 3rd District residents in her state, and she's working to expand access to affordable, quality health care, tackle climate change, protect kids online, fight disinformation, and much more. Unfortunately, the representative is not able to be here today due to a joint meeting of Congress, but we do, of course, appreciate that hard work that she does in Congress. It is now my pleasure and honor to introduce today's moderator, Lauren Gardner. Lauren Gardner is an FDA reporter for Politico and has covered transportation and Canada-U.S. relations, where her reporting took her from the Gulf Coast to the boreal forest of Quebec. Before that, Lauren spent 5 years writing about energy and environmental policy at CQ Roll Call. She started her career at Washington as an IRS reporter for BNA. She is a Philadelphia native, graduated from American University with degrees in journalism and international studies. Please help me in welcoming Lauren Gardner.
Good afternoon, everyone. Thanks for joining us. To set the stage for the discussion today, just a quick overview of what we're going to be talking about. Here in the U.S., nearly 2/3 of the population has been fully vaccinated against COVID-19, and a little more than a quarter of children ages 5 to 11 have received at least 1 dose. But as new variants develop, Latino parents and families are concerned about the health of their children and how barriers to equitable healthcare that have become more evident over the course of the pandemic, how they can impact their ability to protect children from the virus. So today we're going to talk to several health experts, policymakers, and community leaders about the state of the COVID-19 vaccination effort for children and upcoming booster rollouts that are expected, and what this means for Latino communities. So I'm going to go down the line, have everyone briefly introduce themselves and their titles and the work that they do. I'm going to start with Edith Bracho Sanchez to my left.
Good afternoon, everyone. I'm Dr. Edith Bracho Sanchez. I am a pediatrician at Columbia University Medical Center. I will be keeping my mask on for this panel. I will take it briefly off just to say hello. This is my face. I am also, in addition to being a pediatrician, a new mom who has not yet had the opportunity to vaccinate her young child before we changed mask mandates. So I will be keeping my mask on, and I hope to share with you what has been my experience in the front lines as a pediatrician in the Latino community in New York City.
Thanks. We'll go to Jocelyn Bravo.
Hi, everyone. I'm Jocelyn. I'm the Illinois Outreach Specialist for Young Invincibles. We're a national nonprofit organization working to empower young adults 18 to 34 years old to engage in the political process and also working to expand their economic opportunity. Since fall of 2021, we've had a COVID-19 outreach and education campaign targeting young adults to provide resources regarding vaccination and prevention information.
Jeanette Contreras.
Buenas tardes. This is Jeanette Contreras from the Director of Health Policy for the National Consumers League. And the National Consumers League has a long history of advocating for vaccine confidence and consumer confidence in the safety and efficacy of vaccines. Our founder, I love to tell this story, was at the forefront of advocating for vaccine uptake during the smallpox outbreak at the turn of the century. So it is really something within the DNA of our organization to be here. Thank you.
Okay. And Dr. Maria Marquez.
Maria Marquez, good afternoon, buenas tardes. I am a pediatrician, medical director at a clinic at Mary Center, one of the partners in the community that had made sure that we had vaccinated our community members, and I'm one of the community members, so I can tell you historically how we had achieved this amazing coordinated campaign at the federal level, local levels, and community level, individual levels. Thank you for the opportunity.
Great. So what's become clear to me over the last year or so that I've been covering the COVID-19 vaccination effort is that there are two main questions of access. First, making sure that people can actually get vaccines if they choose to avail themselves of them, and then also making sure that people want to get vaccinated. Two sides of the same coin. So first, I wanted to kind of dive into what our panel is seeing in terms of vaccination rates within the Latino communities that they deal with on a regular basis. So Jeanette, maybe do you want to give us a little overview of what you've seen?
Yeah, absolutely. Well, I'd like to start off by talking about a little bit about the recent approval of the booster for children ages 5 to 11, which is timely. So it's wonderful for me. I know my children were first in line to get vaccinated in November. So as soon as tomorrow, when the CDC approves it and makes its formal recommendation, I'm going
to jump in real quick. FDA authorized that yesterday, and
Yes.
CDC's independent vaccine panel is going to meet tomorrow, where they're expected to give their recommendation for CDC to approve it, and then CDC will follow. So that means probably as soon as Friday.
Yeah, as soon as Friday. Yeah, so literally you might be able to go to your pediatrician on Saturday morning and get your vaccine. If the process works this way, as she explained, is that the FDA makes its approval where the scientific staff approves it, then the CDC looks at how to roll this out, effectively, and so they make the recommendations that the providers then look to. So. So that's really big news, and I would say that, in terms of barriers to vaccine uptake, even in messaging around the boosters, it's been extremely difficult. Not only you mentioned the rates of children being so low, the vaccination rate for children being so low, it's even lower for boosters for adults, and it's just really complicated because the guidance says that you're eligible for your first booster 5 months after your second dose, right, of an mRNA, or 2 months after your Johnson & Johnson. It gets really technical. Then for your second booster, it's 4 months after. And so, how do you make consumers and the public aware of all of this? It's so confusing that I think that's particularly why we've got such a low uptake in the booster shots in the communities, not just the Latino community.
Mm-hmm. Dr. Bracho Sanchez, what barriers to access have you seen in your community? I understand that you treat mostly Latino patients.
Yeah, so I'm up in Washington Heights in New York, and my community is over 90%. My patients are over 90% Latinos and Latinas, and it's been really hard from many different angles, right? So on the one hand, it's the information, the misinformation, and the fear that is out there in our communities. And, we sort of speak about this fear and this misinformation at sort of a high level. When you are treating patients as a physician on the ground, and you get this mom, who's a single mom who has multiple kids, who unfortunately have high rates of obesity, right, and high rates of asthma, food insecurity, all these things that sort of go along with many of the challenges that our community faces. And then, they come in, they haven't been in for a while because pandemic has only not only made it hard for them to come in, pandemic has also made it so that there's so many other competing priorities, right? So it's not just, I need to make an appointment, my doctor's backed up, but also I need to make an appointment and I have a million other things to do as a single mom who's caring for multiple kids with multiple health conditions, right? So I'm hopefully painting a picture for you all of how hard it can be for a family to finally make it into the clinic. And then when they finally make it into the clinic, there's still like that misinformation, that fear that they sort of bring with them to our clinics. And unfortunately that translates into, I understand you're telling me my kids may be at high risk of a complication if they get COVID. However, on the WhatsApp yesterday, on my WhatsApp group, there was this story of a kid who got a complication, who got some sort of heart thing, and people, you know, in our community really take those anecdotes and, you know, let them, or, you know, consciously or unconsciously, it plays into their fear. And, you know, on the one hand, as a physician, you say, your kids are really high risk, but on the other hand, they say, yes, but I saw this on the WhatsApp or on the Facebook yesterday, right? And it's sort of like, how do we sort of bridge those things, and how do we do it in a way, you know, that makes people trust and that takes into account all of the other things that hopefully I sort of painted for you all, they bring to the clinics with us. So it's, you know, it's the access, yes, of course, finally making it to us when they have so many competing priorities. It's also, you know, the misinformation that is out there, how do we battle it? And it's also, you know, what has historically sort of been the way that our communities perceive some of these mandates and some of these recommendations, right? Like, yes, that's very nice. You are a doctor, you know, you are, you know, in your position of power. Are you really, you know, able to sort of tell me what I should do with my life, right? Or tell me what I should do in my community? And so it's sort of all of it, and it's so hard to sort of say it and sort of package it in a way that really, really honors the complexity of the issue we're dealing with on the ground. But I hope that in sort of trying to paint that picture, you all understand really just how much of a challenge this has been throughout the pandemic.
How do you feel that pediatricians, doctors like yourselves, have acted as trusted messengers? Do you feel that the community is perceiving you that way, at least in part? And then we can maybe go down the row and have you all talk a little bit about what you've seen in terms of who these communities are trusting to deliver the messages on vaccines and their importance.
Yeah, so definitely, I would say, you know, I have had many families throughout the pandemic who have come to the office and said, I was waiting for my checkup to talk to you about this, right? Like, I know my child qualifies. I didn't want to vaccinate them until I was able to get an appointment with you and talk with you and actually do it in your office, which is great and, you know, makes me feel warm inside. But given how long my wait is, like if you try to get an appointment with me today at Columbia University, you can't get an appointment for 2 to 3 months. I'm just fully booked because we're so backed up, right? So 2 to 3 months of a delay in getting vaccinated against COVID-19. As you know, every day you're not vaccinated, you're vulnerable. So it's, you know, on the one hand, it's great that we are there and that families trust us. On the other hand, we cannot do this alone.
Jocelyn.
Yeah, so like I mentioned, I was involved a little bit in on-the-ground outreach efforts. And with that, we worked a lot in Chicago, specifically like South Side, Southwest Side, Black and brown neighborhoods and Northeastern Illinois neighborhoods. And in my outreach work, I think it really helps being able to provide, you know, Spanish-speaking skills to communicate with individuals whose first language and only language is Spanish. So coming from a place of like just listening to people's concerns, asking questions, following up with answers, and in like communicating with people, there's small issues that they have. Like there was a person I talked to that was in a shelter, and they didn't have like a permanent address. And in Illinois, we had like an immunization website where you could find like, you know, that you got vaccinated, but if you don't have an address, then you can't access that. So going through the process of trying like making sure that the vaccine pop-up there is able to access that. So I think when it comes to having those conversations with people, it's like listening to them, understanding, responding to questions, providing like valuable resources like doctors. And then when they are ready to make that decision, definitely like being the bridge between whatever barrier they're facing, whether it's like accessing their immunization records, transportation. Another individual didn't have access to like a vaccine pop-up that we were hosting, so we made sure to say, you know, vaccines.gov, you'll be able to find one there. So definitely just being there for people and trying to connect them to any resource they need.
Yeah. In terms of like vaccine confidence and some of the misinformation that's out there, I think that you know, there are real genuine concerns. Like for example, when you know, through the adverse event reporting system, we found that many children were presenting with myocarditis, and it's, you know, it causes inflammation of the heart. So, you know, the children were presenting with this, and it, you know, the FDA and the CDC took pause. They looked at the data. They took the report of these incidents and occurrences seriously. But, you know, that I think it just set a chill effect, throughout the communities as everyone was getting ready to vaccinate. And then they were like, whoa, I think it was in December when the myocarditis scare came out. And then people were like, wow, my child might be one of those rare incidences. So it was really hard for us to kind of go out there and say, well, look, your child is more at risk of presenting with myocarditis if they do contract COVID-19, and that's the more serious risk to really consider. And so it's things like that where, the whole FDA's position and HHS's position, I think, was really politicized, where there was a whole faction of anti-Fauci people, it became sort of like, are you on Team Fauci or not? And, that's really unfortunate because it really did just make it more difficult to communicate, the real concerns, and helping to address those concerns when, for example, that happened.
Mm-hmm. So I just want to give a brief. I am from Mary Center. It's called really legally maternal infant health system. We have 5 clinics in the community, Maryland and DC. And it was founded by a nurse who really, really fought for the health of Latinos and Latinas in this community. So our patients are 70% Latinos in this area, and they were very affected by COVID, as we know. After white people, they were the second affected with death numbers in the country. And it took a lot of multitasking and collaboration in this area to make sure that we achieve, actually, is one of the minority groups that are highly vaccinated in the area. Not necessarily the younger kids, but in Latino communities are highly vaccinated in DC. And of course is government, local government, and obviously the coordination that we had and the support that we have from federal and from there to us. But we had done social media. We have done one-on-one interviews. We had done interviews in the streets, in the corners, where people came from Metro. Do you have questions? It's really a more individual level, community level. And we tried to make sure we answered the questions that everybody has. We were not lecturing. We were like, what questions do you have about the vaccine? And we convinced quite a good number because it's really the answers that they're looking for, especially when another trusted group of people, like their friends, families, are bombarding them with misinformation at the same time. And then here you are, Mary Center, trying to make sure that we compete with trusted relationship that we are. But it implied a lot of resources and collaboration with everything we can in the communities. We went to faith-related institutions. We did train people to vaccinate after hours, Saturdays. We even closed a day a week of regular clinic days to make sure that we dedicated that just to vaccination. So everything we try to assess, and that's something that is really important to know and learn by the experiences and what the community feedback is about, right? As you remember at the beginning, there were a lot of scheduling processes that were really complicated for at least Latino communities. I got people calling me, I'm part of the community member, and at church, it's like, how can I get an appointment? People who could make the appointment, they could travel. The other side of the city, they went to Maryland, but our community members couldn't do that. And we decided to then open up, again, as we mentioned, in the streets where they live. We made sure we didn't close any clinic after that because we want to be available to them. And there were a lot of maneuvers that we have to create to make sure that we were available for the community, but always listening to their feedback, individual and community level. And here we are.
Looking ahead to COVID vaccines for the youngest children, FDA and CDC will likely be considering this over the next month. Moderna has completed their submission for emergency use authorization for their pediatric vaccine for kids under 6 years old. Pfizer is expected to follow pretty soon. In terms of being able to vaccinate these communities, people may not be aware, in most states, pharmacies can't vaccinate kids under a certain age. I think it's about 3 years old. And then, as we've all been aware, there's pretty strict storage requirements for these vaccines, the messenger RNA vaccines in particular, ultra cold storage. I'm wondering, have there been discussions within the communities you all represent about how, once this tranche of children is eligible for vaccination, how to ensure that people will be able to access it, given what we just talked about, that trusted messengers have been so key to convincing people to go ahead and get their kids vaccinated? Anyone?
I can start. I would say, so first, I'm one of those moms that's going to be vaccinating as soon as this becomes available. And I've been so candid about sharing that with my patients, actually. So I have, say, a mom that I saw last week who had a 6-year-old and a 3-year-old. And I said to her, your 6-year-old we can vaccinate today. I don't have anything to offer for your 3-year-old. As soon as something becomes available, you bet I'm going to be looking at it as a mom and as a pediatrician to make a decision for my own son. Once I, have looked at it, we have the recommendations from the experts whose lives have been devoted to doing this. You bet I will be calling you, and we will be trying to get your child in. Once we have the data, we know that this is a safe thing to do to protect your 3-year-old, right? So we've been sort of planting the seeds, and the beautiful thing about being a pediatrician in the community is that for many of these kids, I see them so frequently, right? So if you think about the first year of life, they come when they're a newborn, they come at 2 weeks if they're breastfeeding to get a weight check, they come at 1 month, they come at 2 months, they come at 4 months, they come at 6 months, they come at 9 months, and then again at a year, right? So I know those moms, and they know me, right? And I show them pictures of my little baby, and they know we're on the same boat. And so it's sort of like, how are we going to sort of do this together? And I will say, at an institution level, Columbia University and New York Presbyterian Hospital, it's getting really creative. And truthfully, we don't have a choice at this point, right? Like, if anything, we're kind of behind when it comes to how do we reach communities on TikTok, on Instagram, on Facebook. Because if you think about where people are getting their information, that's where they're going. And that's where these young parents of these young kids are going, if you think about it, right? So how do we give doctors and healthcare providers the time, the space, the resources to be out there on those platforms, right? And compete with the influencers who may or may not have any sort of health background, and yet have millions and millions of people following their every move and their every recommendation, right? So at an institutional level, I am so proud and happy to say that we're starting to look at how do we give physicians, nurses, the space, and community health workers the space to explore these platforms to reach our communities, because listen, they matter. I don't need to tell you all. I think you all know that these platforms really, really matter. And the last super quick plug that I'll put in is, Kaiser Family Foundation, and the way that I even got connected with all of you today. They're doing an incredible job, again, just funding and providing the space and the training for physicians, for nurses, for community health workers to be able to share information. And they're putting sort of their machine behind these people to be those messengers out there. And they're already, because I was emailing with them late last night, what are we going to do? What's the plan? As soon as this drops, how are we going to make content? How are we going to get out there on social media, on regular media, to get this message out there from people who are already trusted?
Dr. Marquez, anything in?
Yeah, so we're already starting to hire and plan it. It started when we thought it was going to come a few months ago, but we know it's coming soon, as we just mentioned. And social media is going to be there. We just need to make sure that as soon as it's approved, it's going out. And again, we have a machinery. Again, even like the mandatory vaccines that the CDC recommends we are in the above 80% vaccinated population, the highest in the country. I mean, even in the area. So we're using the same machine. So we have pods in the street that are Mary Center in collaboration with other organizations, and like United Healthcare and Salud y Bienestar. So we're ready, and we are already starting to hire people and train people to be ready to vaccinate 6 to 5 years old. I really highly recommend it. They still get infection. Around 20% of the population of the infections are kids. And we need to let the parents know that the more we get vaccinated population, the better we're going to be protected soon, and hopefully a more normal environment. And I tell them, people, like, we can start dancing again. I love dancing, and in couples, I mean, I don't like to dance alone, so I'm like, we hope that we can start dancing again with friends, not necessarily your spouse that you know is healthy. So I really think it's important to tell, but this is part of my culture, and we have to try to communicate culturally sensitive to our communities as well. So, yeah.
I think we've been touching upon this broadly throughout the conversation so far, but just to put a finer point on it, all of you play a role in ensuring that parents and even children themselves have the information they need to make decisions about vaccinations. So, we've talked about one-on-one conversations and the importance of kind of using your position within the community, whether you're a doctor or a community organizer or what have you, to speak to these families one-on-one. But more broadly, what other strategies are you all employing to reach out to these families to ensure that they have accurate information? I know, Edith, you talked about utilizing social media and using that to counterbalance what some people may be seeing from the influencers who don't have a health background. What other strategies that maybe we haven't talked about so far could you all highlight that you've found to be useful?
I would say traditional media is also really, really helpful. And we sort of talk about everyone sort of moving to the digital world and like who's even watching TV anymore, who even listens to the radio anymore. And my answer to that is our community. Because our people really, really still listen to the radio, really, really still watch Univision, And so how do we get on those shows that are listened to by millions and millions of people? And how do we do it? How do we go on there and, have those points ready to go and are funny and are engaging and are like, when I go on these shows, I sort of even work with the producers to send them pictures of my little baby ahead of time. So when I've been on the shows, like there's been footage of me like nursing my child, playing with my child, because I think it's so important in an era in which we are competing with people who are incredibly charismatic, right? And just carry millions and millions of influence on these social media platforms. That when we go on there, people see us as human beings and not just, a physician in their white coat talking to me from their office, right? Mm-hmm. So it's not only getting on there, but like once you're on there, it's like, can you be candid? Can you give accurate, good, health information, health recommendations, and also do it in a way that helps people see you as a human being and trust you? And do you do it then again and again and again? And people learn to sort of expect this information from you. And I have to say, like, not only like my institution, but also, Kaiser Family Foundation. And one of the things that they have done so well, is that they have created, the short content that can be shared online and on social media platforms. And then at the time that the content is being dropped, they've sort of booked interviews around the country for all of us, little army of people who have been part of the content, right? So when new boosters, when new, vaccines have been approved for different age groups, they have the content ready to go, and then they have the space on regular media to talk about it and create some buzz around it. So it's, at the end of the day, I think it's the creativity and it's the, being candid about, that we're human beings out there in the community that are also making these decisions for ourselves and our families.
Jeanette and Jocelyn, what about from the non-medical side of the advocacy coin?
Would you like to take it first? Go ahead.
Yeah. So with community work, I think the beauty is like going to those community events where people aren't necessarily, looking to get vaccinated, but they see a table with resources and they could go up there and ask questions about boosters, vaccines. In my experience, we've gone to community colleges, universities, and it's always surprising to just realize like the amount of, again, like not only misinformation, but lack of information. A lot of college-age students weren't even aware that boosters were being heavily recommended in the end of last year. So going to places like vendor markets, like we actually hosted a vaccine pop-up during a vendor market because that's where young adults were going to be at, right? You want to go and buy stuff, you can also get your booster. So we try to meet people where they're at, which is I think a theme of outreach work. And I think that really facilitates conversations because people are getting other needs met, whether it's like entertainment or being connected to resources like mental health, healthcare, and so on. So I think that's another method, is just going to places where people are going to be at and then providing those resources to them.
I want to add a little bit about the social determinants of health and how those create barriers to access, right? So if we're addressing health disparities in general, then we really are going to be facilitating access to vaccines, right? Because we have transportation is an issue, right? The theme is, you're a trusted partner in the community, but if there's lack of access to transportation because maybe a lack of, a lot of the low-income communities suffer from food insecurity. And so, if you don't have local farmers market in your area, you have to take 3 buses to go to a grocery store, you're more, and especially during the lockdown, I mean, this created, some major issues for families to get healthy foods. Obesity is a major risk factor for increased risk of severe illness, so things like even in communities ensuring that they have open green space, parks, safe parks to go to and be at. Some of the parks I grew up near were not safe after dark, but during the day, the children need to play and walk around. And so it's, critical to look at how the social determinants of health really came to light during the pandemic, and that we don't forget that we need to continue addressing those, by, getting in the communities, and continuing to be the trusted voices there.
Mm-hmm. It's a great segue to the next point I wanted to cover. So, Dr. Marquez, how have health services in your community, how have they adjusted to the needs of your community throughout the pandemic, given some of these access issues that Jeanette was just talking about, and how the pandemic really, cast a pretty bright light on some of those, and how that played into health inequities that we just see across the population?
Yeah. So yes, the pandemic highlighted the health disparity that we were living before, and maybe incremented the gap. So one of the things Mary's Center did, we already had telemedicine before COVID. So for us was a very, I think, easy way to do it immediately. We didn't have to close the clinics at all, not one day. We did then concentrated clinics, one in Maryland and one in DC. But we want to make sure that we had a lot of social media connection. We did a lot of Facebook streams to make sure we got to the schools, and we got to, via internet, to the families and see if they had questions. And I think all this collaboration and multiple ways to connect and communicate with the communities allow us to really maintain the patients and the participants to still be coming to the clinic. So one of the things is with telemedicine at the beginning, as you remember, Latino families were really affected in the area, and I remember at that time men more than women, because women usually had at some point women health services, and men didn't, so they haven't seen a PCP for a while, a few years at least. And when they started getting sick, they didn't know what to do. So we started encouraging them, please, if you start having signs and symptoms of immediately contact us or your PCP if it is not us. But we try to make sure that they were welcome. And the nearest possible health center that they had, so always highlighting the needs they had. We also participated in some funding for the families, food distribution, kind of tackling the social determinants of health that were part of this. One of the things is that I think had maybe changed paradigm in some way is that health now has to really take into consideration equity. And measure it, and part of how funding should be is always taking into consideration health disparity and equity, and what this is going to do, the new project or your new ideas, what is it going to do about this? Because I think the most successful implementations are going to be the ones that really prove that are effective to ameliorate inequities.
And another theme I think we've kind of been exploring here is how, there are so many other health conditions that can be exacerbated by COVID and that can make COVID worse. So I'm wondering from each of you, how over the course of the pandemic, how you've been speaking to the broader community about just health issues in general. And, as we've kind of touched on, people put off a lot of healthcare over the course of the pandemic, especially when it was really, really bad. So I'm curious to hear how you've used the COVID experience to kind of get at some of these broader health concerns, particularly in the Latino communities that you all live in.
I guess we can go down the line.
Let's go down the line.
Yeah, so I guess, so just to briefly say what's happened in my community in particular. People have come for a long time, right? So kids have been behind on vaccines. Kids have been behind on developmental screenings, right? So even now, right, like this past week, I've been diagnosing speech delays, nuance and autism that I should have diagnosed a year ago, and kids should have been receiving services and therapies for the past year, 2 years sometimes. It is heartbreaking. Truly, truly heartbreaking to have a child walk into your office and immediately, as a pediatrician, something's not right here, and something has likely not been right for a very long time. And we haven't reached that family, we haven't given that family therapy because they haven't been to see us, right? Because they've had so many other competing priorities, because the wait is long, so many issues play into it, right? So vaccinations, developmental delays, and obesity, let's not even, oh my gosh, like what we've seen, I've seen children put on 50 pounds throughout the pandemic, and it's a combination of food insecurity, right, and buying what's the cheapest, most processed, most readily available, which unfortunately isn't always high quality foods, and also a combination of not going outside because our families, I think we really should start talking about it in trauma terms, right? So many of our families have been traumatized, really traumatized by lockdowns, by loss of family members, by watching. I had a kid, I will never forget, watch his grandmother contract COVID-19 and pass away in the home, right? So that child having to witness that, it's just so heartbreaking, right? So when you think about the implications, the downstream implications and sort of consequences of all of this, it's sometimes kind of no wonder that we're seeing rates of obesity skyrocket and rates of mental health conditions skyrocket, right? When it comes to addressing $1 million question, right, and multifactorial issue that we have to target, and it becomes sort of, how do you prioritize things sometimes? So if I have a mother who is depressed, or a child who is depressed, a teenager who is depressed, I cannot address the depression. And I cannot address the obesity, until I have addressed the depression, right? So I cannot fix your asthma, I cannot fix, your weight, your nutrition, your sleep, until we first talk about your depression and actually help you, get to a better state, right? So in my case, it's been, how do we get creative? How do we partner with community organizations? How do we, work together with psychologists, with nutritionists, with exercise physiologists at times? We have a program to help kids exercise. How do we work with food pharmacies in the community so that we are sort of ready to go, understanding that until we fix some underlying issues in some of our families and we sort of give some basic support for basic life needs, we cannot address the other things, right? So I could talk about this forever, but it's tough because it's hard.
Jocelyn, what have you seen in Chicago on this?
Yeah, definitely. I think since my work is with young adults, we'll say 18 to 34, I think a big issue we've always hear about is mental health. So with Young Invincibles, we do on-the-ground outreach in our 5 regions, Illinois, Colorado, New York, Texas, and California, and we also have an advocacy side to it too. So at least in Illinois, we're definitely pushing for mental health campus bill act in Illinois to make sure that there's funding going to colleges so that they could expand their mental health services. And as an organization, we also work to expand Medicaid in all 50 states, make sure that young adults know about health insurance literacy, healthcare coverage options. A lot of 26-year-olds phasing out of their parents' insurance, that we have conversations about, what the next steps are to access private health insurance. or have employer-based coverage. So for us, it's mostly trying to connect people to other resources that have to deal with like coverage or mental health issues.
So I'd like to highlight the work that we're doing in ensuring that essential workers are safe in the workplace. So the National Consumers League is one of the oldest consumer advocacy organizations that represents both consumers and workers in the marketplace. And so if you think about it, a lot of our Latino grandparents and parents, or working grandparents, right, not the retired ones, are employed in essential services and were placed at greater risk of having to leave the home to go to work. And initially there was a great lack of access to PPE, personal protective equipment, so we were really calling for the need to ensure that, even at, certain manufacturers or production companies that production factories, that our workers were set up in safe, work environments so that there was social distancing, proper PPE was important. And we think about that Dr. Marquez was talking about is the loss that these children lost grandparents, they lost parents because they were at risk. They were placed in these higher risk, employment. And one of the things that I highlight is I would say like a good thing that happened is the American Rescue Plan passed a paid leave provision within the act was to provide employers with a tax credit to allow their employees to have paid leave and to subsidize that paid leave. And this was critical, right? Because these are the folks that are hourly workers. They don't have a salary. They have to, take time off work to go get themselves and their families vaccinated. We don't know if they were the ones with the one vehicle or if they were the ones with, the resources. And so this, putting it into light is that Latino families were really impacted as bearing the brunt of the essential workforce. I think needs to be, recognized.
So I just want to put it there. I'm a physician, so we are scientists, and we believe in data and evidence-based. But we also have to take into consideration individual experiences and community experiences. And I think this pandemic had kind of highlighted that for us. And we cannot do it just with data. So one of the things is we are trying to collect data. For example, we are trying to measure blood pressures and hemoglobin A1C. Those are indicators for high blood pressure problems or diabetes diagnosis. And then tackle into a multidisciplinary way. Mary Center has what we call the social change model. So it has a lot of programs that support health in every perspective. Like we have home visiting, we have FSWs, we have a mental health, a very large mental health component in our clinics. Oral health, medical health, you name it. But one of the things is I want to make sure that is really measuring, asking the question, get feedback from the community, and then go back and implement. It has to happen as soon as possible. And we implemented this for the vaccines, as I mentioned, because when we started really opening all the clinics, we realized we were really behind with vaccination, but we were not only the ones, but it was the entire country, right? We were not vaccinating the kids as we should every 3 months or every 2 months, as we mentioned before. And we did a campaign. Our community is not gonna be behind vaccination, so we reached 84% vaccination for the recommended vaccines. One of the things is we have to make sure that we all understand there's long COVID, that we're not going to talk about it here, but also the unintended consequences of COVID. And we already mentioned, I think mental health is detrimental. It cannot be covered by only PCPs. And I think this is something I want to put it on the table as well, and because I do believe that we need more support from the government. Like, for example, we have an excellent medication that really prevents hospitalization, and it's not available for everybody. And that's something that if we don't get the support that is needed, it's not going to be available for everybody. So the disparity of health is going to be incremented as we speak.
Are you referencing Paxlovid?
Yes,
okay.
I'm talking about Paxlovid. So it is exactly what I think we have to really assess what's going on. We talk about development. I think the autism is not only that we're behind treatment because we don't have enough therapists, but also I think it's an increment. I mean, I used to diagnose autism like maybe once a month. Now I'm really literally diagnosing every day. Every day in the clinic, I have one case of autism. So it's like, and again, some of them are behind diagnosis, like, above 3 years, but a lot of them are below 3 years. So it's ideally 18 months. So it's something that is going to come. That hasn't been published 100%, but people is already assessing what happened to the development of a child who was at home most of the days. And still some families are, and some of them didn't even get COVID. Some of them needed to go to work, and they did get COVID. The lack of a space, our families sometimes have more than one nuclei. They have the extended family living with them, not enough space. So there are a lot of things that are coming, obviously combining social determinants of health. It is something that we all have to look is big, and we all have to start thinking about that.
All right, I want to open it up to the audience now for questions. If anyone has one, there's a microphone that will be passed to you. You just raise your hand.
Hello, everybody. Julio Sala, CHCI Public Policy Fellow. Thank you so much for all the insights. I feel like I have two questions. The first one is, wanted to touch more on Dr. Bracho Sanchez's comments about trauma, but more specifically about grief. We just hit the 1 million mark of people that passed away from COVID. October 2021, a report in Pediatrics Research Journal highlighted how over 140,000 children had lost primary and secondary caregivers. And so when I think about the pandemic and its effects, I think about those children and the long-term effects given the correlations with not having a parent. And so just wanted to hear everyone's thoughts on who is responsible for those kids and if there's any maybe current initiatives that are helping those kids. And then my second question, probably more tailored towards the two physicians on the panel, is if you can think of one federal policy that could help clinicians actually tackle the social determinants of health, because I think medical schools can teach it, you can learn it, and you can have that in your mind, but if this overall health system, whether it be limited time, overflowed with patients, doesn't support that, where do we really go from here? Because it feels like at the end of the day, you can be so equipped, so knowledgeable of it, but you're still almost defenseless as a clinician. It can feel, and for me, from an outsider's perspective. So happy to hear.
You want to start?
Yeah. So, in terms of the grief and the loss and who's responsible for those kids who have lost caregivers, it looks so many different ways for every family. Like at times there's an uncle, there's an aunt, there's a grandma if they've lost a parent. But I think one thing we don't talk about enough is the burden and the lack of support for some of those family members who find themselves in this position, right? Like I'm now raising these kids, right, in the middle of a pandemic with childcare policies that are just, as a mom who has a baby at daycare, the way we don't support families in this country is just horrendous. But so now these caregivers are in this position of having to raise kids without support from communities, from governments, and I wish I could tell you that I've seen one thing that's really good and really, but at the end of the day, what I have seen personally as a pediatrician on the ground caring for these families is families getting really resourceful. We do our best. We have an incredible social worker, and we have incredible psychologists who are really plugged into community resources. Who say there's this program for this, there's this program for that. Look here, look there, right? So we do have those people, but at the end of the day, I have to say it's really been families sort of having to fend for themselves and getting resourceful about how they're going to do this. And in terms of a federal policy or policy that I think would make a difference, I would say, by and large, what I've seen help the most is those people, right, who become resources. So our social worker, our community health workers, who are able to connect families with things that exist out there that we as physicians, I try to keep up, but it's so hard between, it's just to be very candid about this, between insurance companies that are constantly changing the medications that they feel like covering for my patients based on whatever reimbursement rate they can get. Like I can't keep up. Between that, trying to get everybody in, trying to get vaccinations in, like I can't keep track of all the things that exist. So I would say, funding those people that are out there, that are helping, that know the community resources is so important.
Dr. Marquez, do you have anything to add on the federal question?
Yes, so it's very important to know that it is crucial to support social determinants of health, and I think there's not enough research on return of investment, even though we know it's necessary. And I'm trying to do research with NIH about this particularly, and it's really hard to find data about this. So policies, there are not many, okay, that supports this. And I was 21 years a professor at Georgetown, and associate dean, but when I visited Mary Center, where I trained in the 90s, so I knew Mary Center when it was only one clinic, I'm like, my goodness, what did they have done? So it is really looking for the support for programs, right, that are part of health, but not medical. And in different ways, we are very strong on a social change model that I already mentioned. And we just went, for example, to get some funding to get a developmental specialist at the clinics, because this is an issue now with the young kids related to the pandemic. So I welcome anybody who is in the policy making, because this is something is not discussed enough. It's the same with mental health. It's not enough to say primary care needs to do this, because I am not a therapist, I'm not a psychiatrist. I am a primary care physician. So what I can offer is basic, not as a psychiatrist, a specialist who is trained how to communicate, how to do behavioral therapy, and how to partner with a psychologist to help this human being. It's not necessarily that we are going to cover everything possible, especially how it's going now. As you read every day, there are more car accidents in the last year, and I think that's related to mental health. There's more death by addiction, and I don't see that we have enough support about this. So if anyone here is hearing us, please welcome, and if you need more data, let us know. We have plenty to help there.
Hi, everyone. My name is Omar. My question is a little bit more directed towards Jeanette and Jocelyn. So I know approval of the vaccines for children is one thing. Having them with a pediatrician or a CVS available for children is one thing, but also the historical trauma that has led to, or historical systemic racism that has led to Latinos not trusting the health system to begin with. There's a lot of Latinos who don't get the vaccine to begin with because of that trauma, but also, of course, now when I think about those same Latinos thinking about getting their children vaccinated, they might be, of course, much more hesitant to go do that. And I'm curious as to the community efforts, the grassroots efforts that both of you, Jeanette and Jocelyn, think are important to getting children vaccinated going forward. Maybe in sharing some of the work that you've done or have seen or you think is valuable to that effort.
I'll let Jocelyn go first, since she's in the community.
So I think regarding that, it kind of goes back to the question I was asked, but funding public health departments and local clinics, I think is really important, just because then with those services being more affordable and accessible, I think people will be able to develop those relationships with primary care physicians so that they could have their questions answered. I think it's about 20% of Latinos are uninsured, so not being able to develop that relationship with people to have those questions answered. And definitely just funding our local clinics. In Chicago, there are efforts to have more funding for mental health services, because 6 of our 12 community mental health clinics were shut down during the Rahm Emanuel administration as mayors. So a lot of our community members don't have access to organizations that are more culturally affluent, that have those language services where they speak to you in Spanish, they understand your cultural background, they understand fears, especially in immigration communities, being mixed status or undocumented, they understand that that's a fear. So I would say in terms of grassroots, just making sure that funding is going to local clinics, public health departments, and yeah, having policymakers and politicians that listen to their constituents.
I would add, so in a previous role, I was doing ACA outreach to help enroll people in health insurance, and it reminds me of this. It's like we had a real theme, and the theme was there's no wrong door. And we were enrolling people at the food banks. We were enrolling people at the housing projects. We were going to all of the places where they go, where vulnerable populations and low-income communities access the services, the social workers, and ensuring that they have the information needed. And I think that we sort of need to take that model, or that, thinking again, is that there's no wrong door to get a vaccine. It's hard with the 0 to 3 age because the pediatricians have to leave their clinics. They have to go into the community. Again, this is the theme of like meet people where they are. But the housing projects are, like it should be done there, So HUD perhaps could be the federal agency that funds housing assistance programs, could potentially help to partner to fund some of that, work being done in the community. Bridging the digital divide is also important, and perhaps the Federal Communications Commission could also fund federal programs to provide grants in communities that have low access to internet, right, high-speed bandwidth. So there are different ways to think about it outside of the health space where funding could come from. It doesn't have to come from, the local health department. It could be granted directly to a housing community project. It could go to a food bank, because we know that food deserts are an issue. And if we could give a mobile van to a food clinic, to a food bank, and have this mobile van go to a community, that would just be, just make strides to helping address, obesity amongst the other issues that stem from food insecurity.
And so one thing I want to add is that it's really important to understand that public health and medical health, needs to be integrated. I think that during the pandemic, that was a big highlight because we couldn't do it alone. And I think I mentioned kind of superficially this, but it's really part of health is public health. As a pediatrician, I always consider myself public health people. And when I talk to public health people, they say, no, you are not. I say, oh, yes, I am. I mean, I do prevention every single minute of my life professionally. I mean, like vaccines, nutrition, and I am a developmental pediatrician, that's how I say it, because I connect the brain health is the commander-in-chief of the body, and we don't have transplantation for the brain. So believe it or not, today is the most important organ of this body. You can transplant the heart, you can do a lot of things, but not the brain. And the brain is fastest growth and development, less than 3 years old. So pediatricians have to really work on that. Since birth, you have to teach your kid structure, executive functioning. When is the peak of learning executive functioning and prioritization as a human being? 3 years old. So if you try to teach at 6, 18, 26, too late. The brain is very slow learning that. So I'm just giving you an example. It's really a lot of prevention that we have to do, and we have to embrace it. They need us, we need them. We should work together. We should be proud to work together. I think this epidemic showed that it's possible, and without public health, we couldn't have done this amazing vaccination process. I mean, it's not perfect. We still have to do better. But it really worked out. It prevented death around, they estimated like 3 million people prevention of death in the United States with the vaccine implementation and how they did it. I mean, my first vaccine was December 2020. From December 2020 until maybe May 2020, the increment of vaccination was like, shoot, rocketed. So, and it was from the government down. I mean, everybody's like, okay, we had the vaccine, they started centralizing, it didn't work, but we couldn't do it without public health. We had the data, we know it's safe, we know it's very efficient, we like data, but we cannot do it alone. And that's something that I want to put for everybody. We all need to be together to make this happen. Be inclusive, be diverse on intellect, because just doing medicine as we do it is not going to work. Just doing public health. And we are connected. We help each other. We will together improve and be ready for hopefully never, I will see it, but a next pandemic. We weren't already.
On that note, I think we need to wrap up. I think we've covered a lot of ground today about how important trusted messengers are in the community, whether it's a pediatrician or those like people like Jocelyn and Jeanette who are just out in the community talking to people one-on-one. And we've also heard a lot about ways the rest of the federal apparatus, besides just the health agencies in particular, could maybe help fund some of these efforts so that we can educate communities more about the importance of vaccination. So thank you all so much for the work that you do and for taking the time to talk through all of these issues today. I think it was a really great discussion. Thank you.